Welcome to this Step 3 review on behavioral and developmental questions. This video is brought to you by Roadmap to Residency. Today we focus on 4 high-yield areas: attention deficit hyperactivity disorder, autism screening, behavior problems and parenting support, and school problems. Our goal is not to reteach all of pediatrics. It is to show you how these question stems are built and how to attack them quickly. Make sure you are also working through your question bank and a solid review resource alongside this video, because these patterns are best learned by doing many practice questions. Let us get started. Here is what we are going to cover today. First, we will learn how to read a behavioral and developmental vignette, the way a clinician does, asking what the next best step actually is for this child. Second, we will match the screening tool, the diagnosis, and the first intervention to the patient in front of us. Third, we will learn to recognize the high-yield stems for attention, autism, behavior, and school problems. Along the way, we will walk through several practice questions together and explain exactly why each answer choice is right or wrong. This video assumes you have baseline knowledge from your review resources. We are here to sharpen how you take the test. Our first strategy is the most important one for these questions. Find the age of the child and the setting before anything else. The age tells you which milestones and which screening tools are in play, because the same symptom means very different things at age 2, age 6, and age 12. Read the last line so you know whether the question wants a screening tool, a diagnosis, or a first step. Then read the stem with that goal in mind. Next, use the setting. Symptoms that show up in 2 or more places, such as both home and school, point toward attention deficit hyperactivity disorder. Behavior seen in only one setting often points to something situational, such as a stressor at home or a learning problem at school. Train yourself to notice the age and the settings every single time. Strategy 2 is to screen first and then confirm. Step 3. Rewards orderly developmental care. At a well-child visit, the question often wants a validated screening tool before any referral or treatment. Autism screening at the 18-month and 24-month visits, and attention questionnaires collected from both parents and teachers are favorite next steps. Be suspicious of any choice that jumps straight to medication or a specialist before screening is done. Once screening is positive, the next best step is usually to confirm the diagnosis against formal criteria, not to treat blindly. Attention deficit hyperactivity disorder requires symptoms in more than one setting that began in childhood and impair function. Autism spectrum disorder requires both social communication differences and restricted, repetitive behaviors. Match the stem to the criteria before you choose. Strategy 3 is to match the intervention to the child. First, start with behavior and support. For young children and for milder behavior problems, the first-line answer is usually behavioral. Parent training in behavior management, school support, and structure come before medication. For a preschool child with attention deficit hyperactivity disorder, behavior therapy is the first step before any stimulant. Second, match the treatment to the age. For a school-age child with clear impairing attention deficit hyperactivity disorder, a stimulant medication paired with behavioral support is first line. The right answer scales the treatment to the age and the severity. Third, beware the tempting overkill answer. The test writers love to plant an impressive-sounding option, like brain imaging, broad blood work, or an immediate subspecialty referral, when a simple questionnaire or behavioral plan is what the child needs now. Doing too much is wrong just as often as doing too little. Choose the proportionate next step. Let us work through our first practice question, and this one is built to test attention and school problems. An 8-year-old boy is brought in because his teacher reports he cannot stay seated, blurts out answers, and does not finish his work. His parents notice the same difficulty paying attention and sitting still at home and during homework. This has been present for the past year, and his grades are slipping. His physical examination and growth are normal. The question asks for the most appropriate next step. Notice that the symptoms appear in more than one setting and that they are clearly impairing his schoolwork. Read the 4 options carefully and pick your answer. Then we will walk through the reasoning together on the next slide. Let us break this down step by step. First, spot the pattern. We have inattention and hyperactivity that appear in more than one setting, both home and school, that have lasted about a year, and that are impairing his grades. Symptoms in 2 settings plus impairment is the classic picture pointing toward attention deficit hyperactivity disorder. Next, apply the rule. Before any treatment, the next best step is to confirm the diagnosis with standardized rating scales gathered from both parents and teachers. This documents that the symptoms cross settings and meet criteria, so the answer is to collect standardized rating scales from parents and teachers. Now eliminate the wrong answers. Starting a stimulant right away skips the needed diagnostic confirmation. Magnetic resonance imaging of the brain is the overkill trap and is not part of this workup. Reassuring the family that this is normal ignores clear impairment across settings. The correct answer is to collect standardized rating scales from parents and teachers. Here is our second practice question, and this one is about early autism screening. A toddler comes in for a routine well-child visit at 18 months. The parents say he does not point at things to show them, rarely makes eye contact, does not respond to his name, and has only a couple of words. He lines up his toy cars and becomes upset with changes in routine. His hearing screen was normal. The question asks for the most appropriate next step. Notice the social communication concerns paired with restricted, repetitive behavior, and notice the age, because 18 months is exactly when autism screening is recommended. Pick your answer, and we will reason through it on the next slide. Let us work through this answer. First, spot the pattern. The STEM hands you the core features of autism spectrum disorder. There are social communication concerns, no pointing to share, poor eye contact, and not responding to his name, plus restricted and repetitive behavior, lining up his cars and distress with change. At 18 months, this is precisely when autism screening is recommended. Now, choose the screen. The next best step is to administer a validated autism screening tool, which then guides referral for formal evaluation. Reassuring the parents and waiting ignores real red flags. Genetic testing has a role later, after a diagnosis is made, not as the first step. A stimulant medication treats the wrong problem entirely. The correct answer is to administer a validated autism screening tool. Let us pause for a quick word on pacing, because these behavioral and developmental stems are often long, with detail about home, school, and milestones. First, read the stem and then the choices in the right order. Find the child age and the last line first, then read the rest of the vignette with your goal in mind, and only then weigh the options. You have a little over 1 minute per question on average, so do not let a single rich vignette eat the time of 3 other questions. Second, learn to flag, move on, and bank time. If a question has stalled you for more than about 90 seconds, lock in your best guess, flag it, and move forward. Banking time on the questions you recognize quickly leaves room to think carefully on the harder developmental milestones. The best way to make these patterns automatic is to drill many practice questions under timed conditions. Here is our third practice question, and it is about behavior problems and parenting support. A 4-year-old girl is brought in for frequent tantrums and not listening. She is healthy, growing normally, and meeting all of her milestones. The outbursts happen mostly at home, often when she is told no or asked to stop playing, and the parents admit that they sometimes give in to stop the screaming. Her examination and development are normal. The question asks for the most appropriate next step. Think about whether this is disease or ordinary behavior, and be careful not to get pulled toward an answer that does too much. Choose your answer, and we will reason through every option on the next slide. Let us break down this answer. First, spot the pattern. This is a healthy, normally developing 4-year-old with ordinary tantrums that are being reinforced when her parents give in. The pattern points to behavior that responds to consistent parenting, not to disease, so the first line answer is to teach the parents. The correct choice is to recommend parent training in behavior management. Now, the key distinction between the wrong choices. Starting a medication to control her behavior is not first line for normal tantrums in a well child. Ordering brain imaging is the overkill trap when the examination and development are both normal. Referring to a psychiatrist for hospitalization is far too aggressive for everyday behavior. Every distractor does too much. The correct answer is to recommend parent training in behavior management. Here is a critical exam day pearl for these questions, and it has 2 parts. First, ask whether the trouble appears in only one setting or in many. When a STEM describes a school problem, difficulty limited to school, especially with reading or a specific subject, points toward a learning disorder. And the next best step is often school-based educational testing. Trouble that crosses both home and school points instead toward attention deficit hyperactivity disorder. Second, remember that behavior comes first. For young children and for milder problems, behavioral and educational interventions come before medication almost every time. When you see a choice offering behavior therapy, parent training, or school support sitting next to a medication for a preschool child, the behavioral choice is usually the better Step 3 answer. Keep both of these in mind and the school and behavior questions become much faster. That wraps up our review of behavioral and developmental questions for Step 3. Remember the core ideas we covered today. Find the age and the setting first, because in these questions, the child age and where the symptoms appear are your biggest clues. Screen first and then confirm against criteria, and reach for behavioral and educational support before medication in young children. Match the intervention to the age and the severity, and stay alert for the overkill answer that orders imaging or a referral when a questionnaire or a parenting plan is what the child needs. The best way to lock all of this in is to drill questions in your question bank under timed conditions and read every explanation, even on the ones you got right. Visit roadmaptoresidency.com for expert tutors and residency advisors who can help you build a personalized study plan. If you found this video helpful, please like and subscribe so you do not miss our next board review session. Good luck on your exam, and we will see you in the next video.